Alyssa Campbell and Mary Chamberlain in studio right now from the Masonic care community, and they've developed a new program. It's a rehabilitation program for cardiac care patients. And good morning, ladies.
Good morning.
So this is for people who have cardiac issues. Explain.
That's right. Well, we had spoken with some of the cardiologists at St. E's and came to understand that heart failure is one of the most frequent reasons that people are rehospitalized.
Mm-hmm.
And in all levels of healthcare now, people are looking at minimizing rehospitalizations, unnecessary hospitalizations. So that was really what the program came out of. And understanding that heart failure creates a situation where people are unable to do the daily activities that they normally do.
Yeah.
Their heart isn't working as well. They may become short of breath. They can become easily symptomatic when things aren't well controlled. So helping them learn little things about how to control their symptoms. It may be as simple as understanding dietary issues and controlling salt intake. Salt is a big issue when you're dealing with heart failure. Activity levels, how to engage in activities without overdoing. So there's a lot of different things that we're focused on there. And education for families and patients is a key part of the program.
Yeah. Alyssa, why is it that everything that we love so much is bad? And it's maybe not we. Maybe I shouldn't include we into it, but everything I love is bad. Is it that we want what we can't have or shouldn't have, and
I think that's usually the case with anything. But in this case, this is a chronic condition. So these are choices that they've made lifelong. And so we're just going to provide them with some information on how to, still have some things, but in moderation, so that it will overall help their condition and not continue. They're normally very much in and out of the hospital, so we want to prevent that.
And you're talking about people that have had some sort of a heart issue. I hate to say, but really, we can all learn from this, whether you've had the issue or not, because you can prevent ever having the issue in the first place.
I think that's true. Good healthy lifestyle is important for all of us, of course. A lot of our patients that we're focused on may have experienced some cardiac event that has put them in the hospital, and then coming to our subacute rehab setting after a hospital stay with some cardiac diagnosis. So we're focused on heart failure as one of the key components, but it's a multi-focused cardiac care program. So you're absolutely right. That's how you would get entrance into the program. But we do know that helping patients and their family members understand more about cardiac care is important in the big scheme of things.
Well, you mentioned the family members. Why the family members? I think I have an obvious assumption, but why the family members?
Well, I think heart failure affects everybody. If someone is dealing with a chronic condition, it's not just heart failure. There are other chronic conditions that people deal with every day. So the ability to participate in social activities, family activities, these are people who have children and grandchildren. They want to be able to attend their events. Heart failure is a chronic condition that if it's not controlled, people are short of breath.
Sure.
If they can't breathe, they can't do. They usually may end up sitting. Their ability to get out there and do the things that they want to do is really significantly impacted.
It doesn't even come right down to meals, right? I mean, when you're sitting down for I like to say whenever I'm on a diet, my wife always seems to pull out the big bowl of ice cream with a hot fudge on it. And it'd be nice if she would kind of play along. I mean, I don't want you to indict my wife, but you know what we're talking about here.
Right, and they may also be a support system that needs to get them to their appointments.
Right.
Ensure that the right foods are in the home. If they're not really helping them, then they're not going to be successful when they go home.
Got it. All right. How does all of this work? So, if you have a cardiac issue, how do you get involved with the program? Is it something that has to be referred, or how does it work?
What we would do, we normally screen anyone who comes to our rehab programs. So if we see an individual that's in one of the local hospitals that has one of these concerns, we would look at it and determine before they get to us that they would be a good participant. So then we would start that from day one. And not everyone who has a condition may be really someone that can benefit from the program. So they might be very confused. They might have other things that are causing the cardiac problem that may not be the focus. So it's still a new program. So we we foresee that it will probably broaden out to cover other things, but this is the focus right now.
Okay, website, just go on the Masonic
The Masonic
website.
Care website. We'd also like to let everybody know that we're going to be part of the Heart Expo on Friday from 9 to 9 at the Utica College Gym. We'll have a booth there. And we're also a Heart Telethon sponsor. The 8 to 9 a.m. hour on Saturday, March 5th. The cardiac care team will be there taking pledges.
All
so
right.
we encourage everybody to call in and pledge.
All right, guys, thank you so much. Alyssa Campbell, Mary Chamberlain, thank you, guys.
Thanks.
Here's Kristine with an update. Good morning, Kristine Bellino. 8:17.
Good morning. Republican presidential candidate Donald Trump says he definitely disavows former KKK leader David Duke. Academy Awards host Chris Rock stole the show with an opening monologue full of racy jokes, and the cruise ship Anthem of the Seas once again cutting a cruise short because of a storm and illness on board the ship.
Well, we have morning rain and wind possible, and then temperatures will begin to decline. We're at 50. Well, we started out in the lower 50s this morning, mid 50s really early. And then we're down to 49. It'll continue to get downward as the day progresses. Tonight, 19 the low. Tomorrow, mostly cloudy with a high of 37. Currently, it is 49 at WIBX.